Langley Memorial is a 200-bed community hospital in British Columbia, Canada. We've been involved with NSQIP since 2011 and have had a lot of successes in improving care for our patients. In particular, we made great strides for our colorectal surgery patients by applying ERAS principles over a couple of years. After having had so much success with ERAS for those patients, our team decided to turn its attention to some of our most vulnerable patients, hip fracture patients. They felt that the same ERAS principles could be applied to hip fracture patients to achieve similar successes in improving their outcomes. We pulled together our multidisciplinary team comprised of physicians, staff, and allied healthcare professionals from all the areas where our hip fracture patients were treated: the emergency department, the operating room, and the surgical ward. We looked at our NSQIP data to determine which outcomes we had particular opportunities to improve. Beyond that, we focused on the processes we felt would contribute to improving those outcomes. We paid particular attention to perioperative mobility, perioperative dietary support, and delirium detection and management. We utilized a care pathway that incorporated preoperative and postoperative pre-printed order sets to ensure care was being provided in a consistent, evidence-based fashion. As a result of these interventions, over a year and a half, we managed to reduce perioperative morbidity by 33%. Our postoperative pneumonia rate dropped by 50%. Our 30-day mortality rate dropped by 50%. Perhaps most telling, before implementing ERAS principles for our hip fracture patients, only 17% of our hip fracture patients returned to their original dwelling from acute care within 30 days of their surgery. After the work of our multidisciplinary team, 42% of our patients were returning to their original dwelling directly from acute care within 30 days of their surgery. We feel this is a real paradigm shift for the care of hip fracture patients in our community, and we suspect that application of ERAS principles to hip fracture patients should be similarly successful for other hospitals as it has been for ours.